How do you best handle stress, especially when under pressure?
That's always a tough one. I think the best way that fellows can handle stress is to have a support system, maybe in the form of colleagues or family.
Part of it is that I lean on my family, and I have a young 2-year-old son, and he's a great stress reliever because walking in the door and seeing him is a lot of joy, no matter how stressful the day's been.
I think if you have a good family, good social support, I think that's you end up handling everything.
Just reminding yourself to kind of take a deep breath and to think about the big picture in terms of what you're doing at that moment. Surrounding yourself with folks who are helpful in training and also for bouncing ideas up off of. Really just taking your time and going through things one step at a time.
Who is your professional mentor, and what is the best advice he or she has given you?
Oh, I had so many good mentors in my life.
Recently, just since July, I've been up at Massachusetts General and working with guys like Dr. Yael and Dr. Drockman has just been incredible. And I think more than any particular piece of advice, the whole group has stressed the importance of dedication to patient care and also patient-centric practice, which does extend into the interventional lab as much as it does to the clinical space.
The best advice that I got when I was a young fellow from Manesh Patel was probably to say yes, especially when you're a fellow. Say yes to opportunity, and take, even if it doesn't seem like it's related to exactly what you do, say yes to that opportunity. It'll lead you down a path that may, result in future opportunities that are really important for your career.
So I have worked very closely with Dr. Samir Kapadia at the clinic and Dr. Venu Menon, who I consider both of them to be my mentors. And I think the best advice that both of them have kind of given to me is to be persistent in the field. It is a long training and obviously becoming longer. There's a lot of things to learn, but I think with persistent hard work, it pays off in the end.
How do you find work-life balance with such an unpredictable schedule?
It's tough. So having just moved from tropical Cleveland, Ohio to tropical Boston, in the last 6 months I started doing interventional. I actually got married a month ago, and the move, everything kind of simultaneous, has been a lot.
Unpredictability is, of course, the cornerstone of our profession. I think it is important to think about it and kind of try to at least pay attention to be with your family when you can, and not work overwhelm you.
Whenever you're home, you're home. You don't bring anything from the hospital home. You just try to, be the husband, the dad, the friend, the neighbor. And you're at home, and when you're at the hospital, try to do the same. Don't bring, in the hospital, you're not the dad, you're not you're just the doctor trying to do the best for the patients.